Of course, we've heard terms like flattening the curve and social distancing while being reintroduced to medication like chloroquine. And with so much information flooding our screens and devices, we wanted to check in with our chief medical correspondent, Dr. Hebert, who was social distancing himself via Skype. All right. Hello,
Yes,
sir. How are you?
I am great. How are you, my friend?
We are all trying to hold up, I think, trying to make it through,
Yes.
right? Okay, so first,
Exactly.
I want to start with our death toll and infections. Where are we in the stats?
Okay, so right now our numbers are rapidly increasing, CE, and this is what I call the beginning of the middle. This is phase 2. And the reason why I say this is because now that we have the ability to test, okay, the numbers of positive tests are going to skyrocket. And it's not because the virus is becoming more virulent. It's not because the virus is any more aggressive. It just means that we have more tests. But what's going to happen is that as the numbers skyrocket, people are going to get more nervous. They're going to get panicked. Once they start panicking, then their cortisol level will go up very high, meaning that's their stress hormone. It is a steroid. When that happens, your immune system goes low, which means you're more apt to get the disease. So what we must do is to take a deep breath and realize that as the numbers go up, that doesn't mean that the disease is spreading more. It just means that we're getting more testing. The thing that is most concerning to me about that is that we have to remember that for about 3 or 4 weeks before anybody knew anything about COVID-19, the doctors were out there fighting the good fight, taking care of patients that they thought really just had the flu. Right? So that means that doctors, nurses, medical office assistants were all exposed. So if they are exposed, that means that now their tests are going to come back positive. If their tests come back positive, that means that they're going to have to self-quarantine. So there's going to be a doctor, nurse, medical office assistant, healthcare worker shortage. And when that happens, that's when people are going to be more upset. And as a Black community, we already have really bad service in our urban areas. We don't have a lot of hospitals, don't have a lot of doctors' offices, don't have a lot of doctors, which means this is going to be worse for us. Also, one more thing, it's that our communities are very close-knit, meaning that they're very tight, especially like in places like New York, very dense. And that's kind of like the way China is. And I've been there many times, and Wuhan and Nanjing and all these places are very tight. I'm concerned that this is going to make it spread worse in the African-American community.
And let's talk about that curve. We're trying to flatten it. What does that mean? I know you've been talking about it a lot, but I think that one of the problems I'm seeing as I'm watching this coverage, I think that there's a lot of hype and a lot of words being thrown around, and I am like you. I don't want to stress out. I don't want my family to stress out. And like you just said, it really is bad for your immune system, so I want to get the facts out about flattening the curve.
Okay, what that really means, and pay very close attention, everybody, because this makes a lot of sense. When you are trying to quote-unquote flatten this curve, what happens is that if everybody is staying together and not social distancing, what that means is that at one point, let's just say 100,000 people went to like the French Quarter in New Orleans. That means 14 days after that big parade or gathering, that means everybody's going to get sick at the same time, which means 100,000 people are going to go to the doctor or to the hospital at the same time. That's going to overburden the system, and that can't happen. So what we're trying to do is say social distance, because you've already been exposed, but let's just say if you stay far away, people are going to get this, but there'll be 10,000 people at the emergency rooms a day over 10 days, which is still 100,000 people, but it doesn't make it so that the hospitals are overburdened. We have a real example of that. In 1918, in the Spanish flu, Philadelphia decided to have their big parade in 1918 when they knew that they had the Spanish flu, and then they had 16,000 deaths in about 6 weeks. St. Louis, which was only 900 miles away, decided at that same time that they would do social distancing, and then they only had a few hundred deaths in that same amount of time. So that's where this is modeled from. So that's why social distancing is so important, and we have to do it, folks. We have to do this.
Now, we're hearing a lot about chloroquine. I think that some people might think it's a miracle drug, but it's not. It's under testing. What is that drug, and how is it? It seems to have some positive outcomes right now, right?
Yes, and the situation is this. It does have some positive outcomes, but the reality is that the president keeps saying that it is an FDA-approved treatment, and it is not. It is not an FDA-approved treatment. Can doctors prescribe it for anything they want to? Doctors can prescribe anything they want for any time and any reason, basically. But this medicine is not approved for that. And so what we need to remember is that this medicine is really it definitely needs to make sure that the people that are taking this medicine know that it is experimental, and please don't go ask your doctor for this medicine. Please don't, because it's just not something that is appropriate now.
And lastly, before you leave, one of the things I've been wanting to talk to you about, we are seeing a lot of hoarding of different household supplies. What are a couple of things that you think that every household needs to have right now? Just some very basic items when folks are going out, and the ability to shop a little bit.
Yeah, you need to have bleach. Okay, you really should have bleach. It's very important, but please don't drink it. People are mixing bleach with water and drinking it. That is not good. That's the first thing. You should have some bleach. You should have hand sanitizer, 60% alcohol. You should also have gloves. Gloves are important, but remember, just because you wear gloves, you still would have to wash them, or you have to use them over and over. I think the most important thing you could have right now is soap. Because soap, when you wash your hands, will release the surface tension on the skin, let the virus go away, and get washed off with the water. It doesn't have to be hot water, just water to rinse the virus off. That's what you need, and you need social distancing. You need to stay away from each other. That's the most important thing, CE. And I know that's tough for us, but if you don't, then we're going to start looking more like Philadelphia as opposed to St. Louis. And that's not what you want to see.
All right, Dr. Corey Hebert, thank you so much for spending a little Saturday with us here. I do appreciate that. I appreciate your information, and I know You're working hard. You are also part of helping to save lives, and I appreciate all of it. Thank you so much.
Thank you, CE. I appreciate it.